Hello and welcome to the American Massage, Chiropractic and Acupuncture Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in San Diego, California, April 20th through 22nd, 2012, and who are brought to you by the One Concept Group. I'd like to take this opportunity to thank our 2012 sponsors, Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy Careers for making this year's event possible. Our special guest today is Dr. Michael Cohen. Dr. Cohen and I will be talking about his 3-hour class on the Acuball. But before we get started, let me tell you a little about Dr. Cohen. Dr. Cohen's firsthand experiences with different healing traditions around the world helped to create his unique patient self-healing techniques. A 20-year practicing chiropractor and acupuncturist, Dr. Cohen developed the Acuball self-healing tool for muscle and joint pain relief, and it is now used by thousands of therapists, the National Ballet, the NHL and NBA players, and many hospitals. Dr. Cohen, welcome to the American Massage, Chiropractic and Acupuncture Conference pre-conference broadcast series. I'm really excited to talk with you today and learn more about your class on the Acuball.
Great, Felicia. It's great to be here.
Wonderful. Well, we are so glad to have you. And I know from attending the Canadian Massage Conference that you've been a regular presenter there in the past, but this is your first year at this conference. Why do you recommend massage, chiropractic, and acupuncture practitioners or students attend the American Massage, Chiropractic, and Acupuncture Conference?
I think everyone does their best work when they are educated and inspired, and I think that's what this conference will do.
Oh, no doubt. There's going to be some amazing education, not to mention events, which I'll tell everybody about a little bit later. Is there any particular reason that you wanted to be a part of this conference in San Diego?
I really like the people who organize the conference. I think they do good work. I think it brings really good people together, and I love the energy of the event. We've always found it a fantastic vehicle to educate people and inspire people to do self-healing work with their patients, and that's why we're there.
Well, I know that every time I've been at a conference with you, I have seen your booth swarmed with people who've come out of your classes and they are ready to try the ball themselves or purchase it for their practice. So I know that this is something people are going to be excited to learn about, and many other things at the conference, of course.
Right.
So let's just start with an understanding of exactly what the Acuball is and how it works. Can you tell me a little bit about it?
Sure. The Acuball, most therapists have used tennis balls or golf balls with their clients. It's pretty well established as a way to release muscle, joint, and connective tissue tension. And I did the same. I traveled around the world studying native healing in many different countries, and I was very impressed when I was in China. They had an actual self-healing ward in the hospital in Beijing where I was studying, and I used to spend time there every day, and it just made so much sense to me that people should be doing their own self-healing work as well as getting care from their practitioners. And when I came back after that, I started using tennis balls and golf balls like other practitioners, and was very impressed with the ability that the patients had to self-regulate their pressure work that they were doing, first of all, and number two, to find things that even I missed in my exam. I think I'm fairly thorough in my work clinically, but there's no way you can be as thorough as a patient who has oodles of time and can start feeling and sensing exactly where issues are in their body. They're way more capable. So when I would combine the patient's investigation with my investigation, we always got a better outcome. And that's really how it started. And then after about 6 years of using tennis balls, I basically got frustrated by the limitations. I mean, a tennis ball is for tennis. A golf ball is for tennis, for golf. So I wanted to design something that was made for the human body And little did I know what I was getting into at that point. I thought, oh, this will be no problem. I can do this. And it took 10 years to design the Acuball and get it working to the level that it's now at.
Wow, that's pretty amazing. I wouldn't have thought that, but I guess in developing prototypes and finding exactly the right materials to work and manufacturers and all of that sort of thing, it just does take a lot of time, doesn't it?
Yeah, well, we released it after 7 years and then quickly realized, oh, this could be better, that could be better, this could be better, that could be better. And so the version that people are now using when they buy one is 10 years of work, and we're very proud of what we've created. We get wonderful feedback from practitioners all over the world.
Well, it is a really interesting device. I've actually had a chance to use it a little bit at the conferences myself, and I think everything that you're saying is right on target. I think that's a very, what's the word? Maybe a humble way to look at things. A lot of practitioners think that, well, I know best, and I can only be the one who can treat the patient. And I think, or at least I've encountered that from time to time, I'll say, and it's great to have the mindset that you and your patient are working together, that you're a team, and that you're providing them with a resource where they can help you make progress, that it's not just up to them to come in for a treatment with you in the office. I really admire and appreciate that a lot.
Thank you. It's very, very evident to anyone who does this that, once you start using these techniques, and you don't have to use an Acuball. You can use a golf ball, use a tennis ball, whatever you want. The important thing is to get patients doing their own healing work. When they start doing that, there's no way you can deny it. There's a big difference in the clinical outcomes, and you have a way happier patient, because what patient doesn't want to be empowered to do their own work? Everybody does. Everyone's looking for ways today to help themselves and to be more capable to do their own healing work versus being dependent on a practitioner. So you're really just tapping into what people want, and I think what they really appreciate is a practitioner who's willing to let them go. That's how you build a practice that's based on really, care. And people love that, and it's a great way to build your practice. It's a great way to build a name in the community as well, because the biggest turnoff today for patients is endless care.
I agree.
They don't want it. They don't respect it. And in my opinion, it's destroyed a lot of the trust that was built up by early practitioners. And it's generated by money. It's not generated by truly caring for the patient. I think when you use techniques that empower the patient, they really appreciate it.
I definitely, again, agree with that. I've found in my own practice, I'm a massage therapist, and I've had clients of mine come in to me and say, well, I went to so-and-so, and they recommended I come in 30 times, whether it was for a particular type of body work or for chiropractic. And they felt really turned off by it. And they said, why do I have to go so many times? Is that really the only thing that can help me? And that there was an immediate stop sign, in their face, thinking, no way, I'm not going to do this. Where I think if the practitioners had approached them with, here's a combination of things you can do at home along with some office care, they would have been more open-minded to it instead of just been given a menu of come into the office only. So it sounds like you've really got a great tool that isn't just for self-care, but it's for business care and client, relationship care.
Right, and it's also very powerful as a clinical release tool. In my practice, I use it during sessions. Let's say, for example, a patient has a tight T5 area, very, very common today, everyone hunching forward at a computer. So I will lie them on the large heated Acuball, and for those of you who don't know what it is a ball that has a groove running around the center that accepts the spinous processes of the patient. And on either side of that groove, there are nibs that go into the paraspinal musculature and release it with acupressure. So they heat up the ball, they lie on it, I leave them for 3, 4, 5 minutes, then I come back in. There's a notable difference in the joint play and the muscle tone. Then I adjust them. So I'm also using it because it makes my job a lot easier. And the patient, once they experience it in the office, 1 out of 3 of them is like, wow, what is that? I want that. So they buy it, which is a great ethical revenue stream for the practitioner as well. So I use it as a home care tool. Everybody gets it. But I also use it a lot as a clinical tool because, let's face it, when patients are really tight, it's so easy to burn out your hands. It's so easy, and practitioners, we tend to be give, and we burn out ourselves, and we don't really, stop. I mean, that's the way most practitioners that I know are. They just give. So what the Acuball does for me clinically is it enables me to not burn out my hands. I get the patient to do the work on the Acuball, and through that format, they train themselves, and they also open up so that I think it's a win for everybody.
Now, just to clarify that, I guess maybe to expand upon it, really, it can be used as a home care tool for clients and to make clinical treatment easier. Are there also some self-care techniques that practitioners can utilize with the Acuball?
Oh God, yeah, absolutely. We do seminars for hospital staff and clinic staff all over the world, and practitioners need it so badly. As I said, they tend to be givers, and they're not really good at self-care. As shocking as that may sound to people, if you're a practitioner, you know exactly what I'm talking about. It's a fantastic tool for practitioners. I mean, I use it every day. I have to. I'm busy in my office. I'm busy working, and my body needs the release. So it's great as a self-care tool to open up tight joints and muscles for the practitioner. One of my favorite areas, because I'm hunching forward working on patients, and my thoracic junction, my thoracolumbar junction, especially TL junction, gets a lot of strain because I'm always forward flexing there. Is I'll put the heated Acuball behind me around T9, T10, and just relax, and you can feel the ribs actually start to move laterally, anteriorly and laterally, and the diaphragm muscle open. You can feel it, and it's it's a wonderful release. Like it is a definite maintenance tool because we all know people who've paid the price with their bodies.
Well, definitely. As a massage therapist for almost 18 years, I've definitely had many of those times where I thought, oop, I just went a little too far, or I really could use a massage between these clients or some body work to try and be at my best. So tools like that can be a lifesaver sometimes. What exactly are you going to be teaching students at the conference in terms of utilizing this tool in their practice or for self-care or home care?
Yeah, so it's a 3-hour class. So the first hour is going to be teaching the practitioner how to care for their body. It's got to start from there. They've got to experience it personally, and they will. It's totally interactive. Each practitioner will get a large Acuball, which is utilizable on the spine, the glutes, the quads, TFL, all the major muscle groups. They'll also learn how to use the large Acuball in the front of their body because no one does work on the front of their body. And it's very interesting. Placing a large heated Acuball on the sternum, fascinating to feel how your body starts to peel off, let go of those layers of contraction over time. So we'll be using the large Acuball. We'll also be using the smaller Acuball, the mini, for the feet, the shoulders, the arms, the absolutely essential forearms, fingers, and hands. And we'll use the Acuball Mini as a massage tool. So practitioners will feel on their bodies the changes that happen. And everybody feels it. Within 30 minutes of using the balls, they get up and they're like, oh my God, what a difference. And I always point out to them, and if you go to that class, you'll hear me say this line, congratulations, you just did that to yourself. And that's the whole idea that's underneath the whole Acuball program is we've got this amazing self-healing power, but no one's shown us how to use it. And I know in countries where I study, like Indonesia or India or China, or I'm going to India in about 4 days to keep doing some study there. Self-healing is part of their culture because they never had technology. They had thousands of years where they had to squeeze every drop out of self-healing because they had no other resources. And they've learned through doing that how to do work that we simply have no idea to do here. So I'm trying to bring some of that consciousness of using self-healing as part of our everyday lifestyle to the practitioners here in North America. And from the enthusiastic results we're getting from the practitioners, it seems to be working very well.
Well, as I said, when I've been in Canada, where you've been teaching, people race from your class to go and purchase the ball. It's obvious once they have experienced it in their own bodies, just how powerful that is and what an amazing tool it can be for them. Whether they ever end up using it on their patients or not, who knows? But they've felt it themselves and say, wow, I got to have one of these to take care of me for a change. And, I've only used it on my back. But when you were talking about putting the heated ball on your sternum, I thought, I actually am one of those practitioners that does a lot of work on the front of the body. Probably 75% of my client sessions start with work on the pecs and the abdominal muscles before I even work on, the place that they complained about. And on myself, I really like that type of work. And I'm thinking, ooh, I can't wait to try this heated ball on my sternum because I've had rib injuries on both sides, cracked ribs on both sides from different accidents. And I'm pumped to get there and try it again, but yet in a different way. I hadn't even thought about it as a tool to use on the front of the body.
Yeah, it's pretty powerful. The other area I'd encourage you to try is your diaphragm as a diaphragm release tool. Just tuck it underneath the xiphoid process and let that open. And then the other area, which is we're getting dramatic results with low back pain patients. Dramatic is we use it, the patient's lying on their front, and we use the heated Acuball on the symphysis pubis.
Oh, wow.
It's amazing to see what happens. Just amazing. I mean, I stumbled across this by accident. We do Acuball training seminars for different groups, and one of the patients who was pregnant who had a symphysis pubis issue after she gave birth, we started working with her, and then I started doing it with other patients, and I noticed they were all saying, wow, my back pain's so much better. And boom, out came this whole new therapy that just happened by accident. And it's fantastic. And what seems to be happening, and we don't know this for sure, but it's conjecture at this point, but definitely there's something happening, is that when the symphysis pubis opens, it seems like the connection to the sacrum and the pelvic joint starts to open as well, which releases the low back, because there's a definite difference. Within 3 minutes of having the patient lie there, they get up and they say, wow, I can't believe the difference in my low back pain. So one of the things we've noticed just from years of using the Acuball is the key kind of premise that if there's something going on in the back of the body, always treat the front of the body as well, and vice versa. So we get our patients to utilize the Acuball all over. And you'll see if you go on the Acuball.com website, there's a section that says, where do you hurt? And we created that for practitioners and patients because there's a lady that comes up with arrows to every part of the body, and you just click wherever you hurt, and a video comes up that shows you exactly what to do. And that's really great for practitioners who may not have the time to train their patients. All they do is say, go to the website and click where you hurt. And the patient has a 24/7 resource which shows them exactly how to use the ball.
Wow, it doesn't get much easier than that. I'm sold. I'm sold. Why am I not carrying this in my practice yet? That's what I'm asking myself.
I'm sure, Felicia. You know what? I'm sure after this next conference, when you try it, you will be.
I know. Well, you've talked about some of the conditions like lower back pain and tightness in the T5 area and other places. What are some of the other conditions that the Acuball can be used to treat?
The biggest ones, and in Ontario, where we are in Canada, the Acuball is fully covered for anyone who's had a motor vehicle accident. It's free. And the reason that happened is because the insurance company started to see the results when patients were using it. They need a lot less care. They're able to do a lot of the work themselves. Practitioners love it because they're able to break through really tough patterns because the patient's using it every day, 1, 2, 3 times. So when they come back for a treatment, they're through a lot of the tension levels, and the practitioner can go much deeper and do the work they want to do but just can't do. So it's great for anyone who's had any kind of an accident that creates a contraction issue, whether it's in the muscle, connective tissue, or joint, anywhere in the body. So the entire spine, all of the major muscle groups. One of my personal favorites, I'm using it a lot as a kind of two-part technique with people who have computer issues, because, you know, a lot of people are hunching forward at their computer. They're very frustrating clinically. There's actually a section in the class that I'm going to teach which is just about that, what to do with your patients that are on computers, because, you know, you treat people like that, Felicia. They're very difficult to treat because they come back with the exact same issue every week.
Right.
They're always hunching forward. They're always so sucked into that computer screen that their mind is totally not focused on their body, and that's how they hurt themselves. So one of my favorite things to do, we get the user to put the heated Acuball under the lumbar spine in their chair while they're working, and it creates an instant lumbar lordosis, which makes the other curves align with no effort. Mm. Then we get them to use the mini ball underneath their feet while they're working to create neuroproprioceptive input to the CNS to open up their feet musculature to keep their body engaged, because the big issue is they're not engaged, right? They're just so sucked into the screen, their body is tossed to the side of their consciousness. So we find that when we keep them engaged, huge difference in the way that patient's body responds. And again, patients are in love with it because they feel so much better, totally different at the end of the day.
Well, it sounds wonderful, and I know exactly the kinds of people you're talking about because I actually am one of them. Oh. Despite being a practitioner, half of my life is spent in front of a computer doing writing and preparing things for trainings and broadcasts like this where I'm preparing scripts and that sort of thing. So I'm unfortunately one of those people, and I'm always looking for ways to improve my posture, have better awareness. So I just see all kinds of possibilities for me. And there's lots of positive ways to use it, but what about contraindications? Are there any reasons that people shouldn't use the Acuball or any conditions that are going to be adversely affected?
Yes, there are. If a person has recently had an injury and there is inflammation, swelling, discoloration, bruising, any fractures, you're not going to use the Acuball. The Acuball is not for acute injury. It's designed to be used after all bruising, discoloration, and swelling have receded, and now your job is to open up the tissue that's been contracted. Then you bring in the Acuball. So it's not for an acute condition with any swelling, bruising, discoloration, inflammation. You never use it there. You obviously don't use it on a person who has a fracture. You obviously don't use it on a person who has a severe issue with any kind of discoloration on the skin where there's some kind of infection going on, subdural. So anything like that, you're not using it. The only other contraindication, and we've never actually had a problem, but it's something that my lawyers make me say, is that if a person has severe osteoporosis, not to use it. Now, we all know those patients, it's a very unfortunate state to be in because they can turn in bed or take a step and they fracture, right? So obviously someone like that, you're not going to have them lying on the Acuball. But it's a very, minimal contraindication spectrum, really. It's very minimal.
And I noticed that you didn't say pregnancy.
Oh, my God. Pregnancy is a huge indication.
Okay, good.
My pregnant patients live with that Acuball. They literally carry it with them in their purse everywhere they go because they can't take medication. They're constantly in pain because of the body changes, and the Acuball is a godsend for them. They love it.
I'm sure. I know many of the pregnant clients and various friends that I've had, they're miserable. Something hurts all the time, or at least many of them. And laying on a massage table for even 30 minutes is just too much for them. They can't handle it, but they could lean up against a wall and use that, or even maybe lay on the floor for a few minutes to work on themselves.
A lot of them use it in bed and in a chair and on a sofa. So they'll put a heated Acuball behind wherever they're sore. A lot of sacroiliac joint dysfunction occurs, and so they'll be using it there. A lot of low back pain occurs, so they'll be using it there. So they love it. Oh, they love it.
Yeah, I'm sure. Well, now, you mentioned earlier before that this is an ethical retail product. How effective is it to offer this as a retail product and to increase revenue in someone's practice or business?
Well, I think it's a really great way to increase revenue because you couldn't get more ethical than saying, here, go heal yourself.
Right.
Call me when you need me. I'm here for you, but I care enough about you to give you a tool that will allow you to do some of the work on your own. That's a big statement that you're saying to your patients, right? And they love you for it. They respect you for it. So I think it's a wonderful revenue tool. All of the Acuball products that we have are 100% markup from the practitioner to the patient. So they make 100% markup. And we always guarantee everything. So if there's ever an issue, we will always refund the patient. We will always return. If there's a defective unit, anything that happens, we're behind it. So for practitioners, it's really a no-brainer. They have nothing to lose. The only issue we've run into, and I want to tell you this is kind of remarkable, but it exists. We've had practitioners who say, why would I want to make my patients need me less?
Right.
And when people say that to me, I just say, if you think like that, I've got news for you. The future is coming. And the future, patients want to be empowered. You can either be part of that empowerment or you can be by the curbside. But if you think you're going to get away with this, you're not. The truth always rises. They're going to find out about it. So I think it's an excellent way to communicate your ethics to the patient, and it's a great way to generate revenue because of the sales. It's a very easy product to sell, and as I explained earlier, I use it during my practice sessions. A lot of massage therapists, to give you an example, they will put it under a patient's C-spine and then they'll work on their feet. Then they'll come back to the C-spine 10 minutes later, and it's so much more supple. The muscles have released. The joints are open. Much, much easier for them to work. Once the patient has felt it, they want to buy it. 1 out of 3 patients who experience it clinically will want to buy it because it's very reasonable. The large Acuball retails for $30, the mini Acuball for $20. So it's very reasonable. From the practitioner's point of view, because it saves their hands, they're using it all the time, right? So I think it's a win for everybody, except the unethical practitioner.
Right. Or someone that maybe has a limited view and doesn't see how seeing your patients less and doing less work, yourself can actually bring you more business. It can bring you a higher level of profitability. And more importantly, in my opinion, and this is one of the things I stress when I'm teaching practitioners how to retail and why, is that your patients are satisfied. They're happier with your work because they're getting what they want and need faster, and you're helping them do it that way and not just saying, oh, you have to come in and see me to get it.
Absolutely. And if I could say there's another thing that I've noticed in practitioners, and I notice it in myself, I feel so good doing this with patients. My energetic state elevates. Patients pick up on that. They want to come to a practitioner that has this glow about them of doing the right thing and doing it for the right reasons. You can feel it, you can sense it when a practitioner is in that state of mind, and that is who people gravitate to. So, it's in all your practices, obviously. It's not just using the Acuball, but it's the kind of practice that really grows from the patients having a respect and therefore referring to the practitioner, and it's the way you want to be.
I agree with you. On all counts. And we're going to wrap up shortly, but before we do, Michael, I want to just ask two things. First, do you have any self-care advice for people that are listening to the call? And, they don't have the Acuball yet, but what can they do to take better care of themselves using some of these same ideas, I guess?
Yeah. Well, if you don't have an Acuball, but you've got a tennis ball, most people have access to tennis balls. And I know so many people out there know this already. They know to put 2 tennis balls in a sock. They know about that. But take care of your paraspinal musculature because it's constantly under tension from the forward leaning you do when you're working. And take care of the forearm muscles because they're constantly being used. All of the flexor tendons, all of the musculature in your forearms that you're using when you're working on patients. So take a golf ball and with your opposite hand, just make circles and rub and try to work those out. It's a lot easier than using your fingers to work it out because your fingers are already overused. So the kind of idea here is to use other tools to release known patterns of contraction in what you do. I know as a chiropractor, big issues with low back pain with chiropractors. A lot of chiropractors have it because of that. They're leaning forward, they're holding patients, then they're kind of moving them around, a lot of strain. So use tennis balls bilaterally on your erector spinae. Just lie there with your knees bent, soak into it, and give yourself a good 3 minutes and breathe and let the tissue open. Most people, they simply don't spend that time to open themselves up. The other thing that I'm advising every practitioner to do is yoga at the comfort level and class that you're comfortable with. Yoga is very powerful on many levels, and anyone who's up on the research knows that the future is going to be yoga. You can't deny the research coming up on so many different aspects of health and wellness. But yoga, it's a very sophisticated tool. It's been developed over thousands of years. That's a great thing for practitioners to keep their body healthy. And the big one that I always recommend to the people we do seminars with is take a vacation of a minimum of 2 weeks. It takes 1 week just to calm down. People say to me, I go away for 3 days here, I go away for 4 days here. Sorry, it's not doing it. And in the long run, and this really is a marathon that we're in, we're not in a sprint. In the long run, the practitioner that takes off time, 2 weeks minimum time, enables their body to regenerate, has a far greater practice life, and is way more productive when they are practicing. So those would be my little take-homes.
Great advice. I'm definitely going to look into the 2-week vacation this year. So, Michael, I know that some people are going to want to get in touch with you or learn more about the Acuball before the conference, and also to check and see when else and where else you're going to be teaching if they can't make it to San Diego. Would you share your contact information with us again?
Sure. Our website is the best place to go, and it's acuball.com, A-C-U, ball, B-A-L-L.com. It's very easy to find. You can also research us online. Dr. Oz had us on his show in May, which was a big thing. We were so excited. Yeah, it was fantastic. He actually rated the Acuball an alternative health must-have for back and neck pain. He uses it himself because he's a cardiothoracic surgeon, so he's always hunching forward. He's always got the upper thoracic issues going on. So you'll see if you go online, there's video of him actually using it, and his wife has one. And so you can see all of that stuff online.
Well, that's awesome. And if that's not enough to make everybody on the call want to come to Dr. Cohen's class and to the American Massage, Chiropractic, and Acupuncture Conference, I don't know what is. I'm definitely going to be there, and I want to just share with you some details about the conference and how to sign up and be a part of this great event. The American Massage, Chiropractic, and Acupuncture Conference is one of the largest exhibitions of massage, chiropractic, and acupuncture products, continuing education, and new business opportunities for practitioners of all disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including Dr. Cohen's, a free keynote presentation sponsored by ABMP with Deanne Juhan, author of Job's Body. There's also going to be a charity golf tournament benefiting the Make-A-Wish Foundation and the One Concept Gala Dinner Dance, which is going to be held, I believe, on Saturday night. The golf tournament, by the way, will be before the conference on Thursday. Now, the registration cost for the conference itself is just $40, which includes admission to the trade halls and all one-hour presentations, participations in raffles and giveaways of literally thousands of dollars in prizes, between-class coffee breaks, and loaded goodie bags. Attendees will also have access to many special offers and promotions from the vendors and exhibitors, as well as the chance to have a fantastic time with friends and colleagues. Now, for students, the conference offers a free student day and Smart from the Start program. That's on Friday, and it's sponsored by Massage Warehouse Script and Performance Health. This day is dedicated to massage therapy students who are currently enrolled in school or who graduated in 2011 and includes a free gift bag for the first 350 students. Also on Friday, all attendees are invited to attend the American Massage Job Fair from 2 to 4:30 p.m., which is sponsored by Massage NBA Careers. Now, all of this is happening at the Conference Hotel. That's the Town and Country Resort and Conference Center, and I definitely suggest you make plans to stay there if at all possible. Single or quad rates are available, and they're just $125 a night, but space is limited, so make your reservations now. Also, MPA Media is printing the American Massage, Chiropractic, and Acupuncture Conference event program inside all three of their magazines. That's Massage Today, Acupuncture Today, and Dynamic Chiropractic. These magazines will be given out at the conference and distributed throughout the U.S. to over 80,000 practitioners. So if you are a vendor or an educator who is listening in today and you would like to get some great exposure, please contact Sandy Pierce with MPA Media for details on being a part of the conference program. Now, if you're ready to register for the American Massage, Chiropractic, and Acupuncture Conference held April 20th through 22nd, in San Diego, California, to meet Dr. Cohen, myself, and the other amazing presenters at this year's event, there are two ways to do so. First, you can register online and pick your courses instantly at the official conference websites, which are www.americanmassageconference.com, americanchiropracticconference.com, and americanacupunctureconference.com. You can also register by phone. The call is free, and operators are waiting to talk to you. So grab your pen and jot this number down. It's 877-674-3504. That's 877-674-3504. We also invite you to stay connected with us on Facebook at all of our conference pages, including facebook.com/American Massage Conference. Again, the 2012 American Massage, Chiropractic, and Acupuncture Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage NBA Careers. Of course, I hope after today's broadcast, everyone listening is ready to come to the conference and register for this wonderful 3-hour class on the Acuball with Dr. Cohen. Dr. Cohen, thank you again for taking time to talk with me today and for sharing all the interesting information and knowledge about self-healing and the Acuball with everyone. I'm really looking forward to seeing you again and hopefully to attending your class at the conference.
Great. Thank you, Felicia.
Everyone, this is Felicia Brown, and on behalf of everyone from the American Massage, Chiropractic, and Acupuncture Conference and One Concept Radio, I want to thank you for tuning into this broadcast of the pre-conference broadcast series. Please remember to tune in each week through April 16th for more interviews and to visit our websites and Facebook pages for replays of all the interviews in the series. We look forward to seeing you in San Diego in April, but please also consider joining us for the Canadian Massage Conference, November 1st through 3rd in Burlington, Ontario, Canada. Thanks again for tuning in, and have a fabulous day.